Good evening, good afternoon, and good morning. This is the 944th day of uninterrupted and continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. PRAKASH Rao, BA, MD, Homeopathy. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy is about to celebrate its 1000-day celebration within 56 days from now. This is a grand opening as far as homeopathy is concerned. This is one of the best days for homeopathy to celebrate. So I invite all of you to celebrate the occasion with all pride and proud, because before that we will have a session with our international for celebrating our Handyman's Day celebration. We have decided to celebrate the Handyman Day session in 2 days, on April 9th as well as on April 10th. So hope all of you will be there to celebrate those functions from today onwards. Because we will be having excellent sessions coming in coming days also. I hope our guest is about to join, and we can go to the session's details. And as you all know, our guest is Dr. PRAKASH Rao, BA, MD, Homeopathy. He has holding a degree in postgraduate diploma in physical medicine and rehabilitation. He undertook projects with the UNICEF and AIDS Control Society, and the winner of many awards for the outstanding works for homeopathy in the research field. He has more than 30 years of experience at Central Council of Homeopathy. He has made so many presentations in this forum about research, how to do research, and what are the things you need to look into the research work. And as well as he has recently making a statement that all the homeopathy doctors are our practitioners are researchers, because each and every case we tackling these days are supposed to be a research work behind it. We have a research work behind all these work. So let us invite Dr. PRAKASH Rao this session. And unfortunately, sir has not joined, I think, and he will be joining shortly. And today's subject is a very different subject, because today, as you all know, is the World Autistic Day. So we have arranged a special session on that this day, and sir has agreed to present such a wonderful session tonight here. So please, I think Dr. Sridhara Kurupu can speak for a while on that till our guest is joined. I welcome Sridhara Kurupu sir to say something about the Autistic Day. And meanwhile, I shall contact our guest. Sir, you may please take over from here.
Yes, autism, it is really speaking, the causes was not knowing, but that nowadays in the world there is about to the 1% of the people are suffering from autism. So it is one of the biggest problem. Maybe different causes are telling, maybe from congenital or hereditary, or maybe some other diseases it can occur. But that treating with other ways, that means there is some scholastic skill disorders people are treating, that some psychologists, some disabled trainee people are treating, but homeopathy is having very good remedies. So I can assure we can about to 80 to 90% we can give, even it may not cure completely, but in some cases we can completely cure. No other system cannot do that much but in other ways, if it may try also, it cannot improve more than 50 or 60%. But homeopathy, it will be 80 to 90, or in some cases, it is 100%. We can give result. And so that is one of the best ways to treat the autistic children, that we must have to give simultaneously, give counseling to the family people, whether it may be mainly the parents or to the parent-like people that who are caring the children, make them to make some changes in their thoughts and beliefs. We must have to train them. Otherwise, what happens when the parents may, their period may over, they may be very handicapped, they cannot exist. That I am one such two two children that they are twins. I am treated, and it is one is completely cured, one is about to the 80%. It is what better. That what happens? 3 pregnancies. When I took the case, 3 or 4 pregnancies, there was abortion in the 3rd and 4th month. Then with great difficulty, they got 2 children, twins. But the first one was having later OCD along with the autism. But the second one was having only autism. That second one is completely cured. And the first one was about to the 70 to 80% relief is there. They were not giving any work or not giving any training. But when the guest may come, please kindly tell me. I can stop immediately. Otherwise, it is a big chapter.
Yes, sir. Yes, sir. You may continue, because our guess there is some connectivity problem with our
and then the constitution medicine, I worked very hard with that, the help of to the took the case very detailed and repertories, and I got one person that I got the Beretta card, another person I got Syphilinum, and also I intercurrent medicines used as sulfur and Medorna, but the second person is already doing all the work in house. But the first person is having fear to go to the public, and he is washing the hands. That these are the 2 OCD problems are remaining. Whether the guest came?
Yes, sir. Our guest Prakash Rao sir has joined now, and let us go.
Okay. Thank you very much. So it is possible to cure.
Sir, good evening, sir. Sorry for.
Okay. So I was, in your absence, I was talking about something about my experience. Okay, thank you very much. Now I stop.
Okay. Let us welcome Dr. Prakash Rao sir for his wonderful.
Guru sir, good evening.
Good evening. Most welcome.
Today our guest is Dr. M. Prakash Rao. Sir has already presented many papers here, and today we have to have a wonderful session. We are expecting a wonderful session on autism, the effectiveness of homeopathy in autism. This is the subject of the day. So you can begin the session now, sir. Already I have made the introduction earlier. Welcome, sir.
Thank you very much, sir. Sir, I need slide sharing. You have to give me permission.
Yes. Dr. Baburaj, please make Prakash Rao sir co-host.
Sir, today is World Autism Day, sir.
Yes, that's why we have.
That's why Dr. Dhanesh sir asked me to present today topic on World Autism Day. The autism is for homeopathic doctors. It is like, see, every homeopathic doctor will have an experience of curing warts, cons. In the same fashion, in mental disorders, it is autism that every homeopathic doctor likes to cure the autism cases, and most of the patients will come to homeopathic doctors for taking treatment of autism. Sir, you have to give permission to share my slides.
Yes, sir, I am waiting for that because our IFPH Tech has to do this because I am only a co-host. So I'm just asking him. So you may continue the talk, and in between we will have the.
Okay, sir. Okay, sir. So now I'll speak. The PowerPoint may follow. You kindly, whenever the permission comes, you kindly tell me, sir.
Yes.
What is the understanding the autism? See, I told the homeopathic doctors, their approach will be a holistic approach. This holistic approach will help to deal with various cases. And in that, where in drug proving, we don't have autism. In the sense, we have proved the symptoms of autism, but we don't know in those the case of autism, which in homeopathy, in turn, it will cure the autism cases and it will make the persons who are suffering from the autism normal in the society, and they can have producibility, productivity, and normal lifespan. Homeopathy came, but later when homeopathic doctors practicing, they understood that they will control the autism, they will bring the changes that are needed in the environmental, immunological aspects of the autism. And enough research has been done, and most of the homeopathic doctors in their lifetime, they get one. Sir, okay, sir.
Sir, you are a co-host now, sir. You can slide this. Share this slide now.
Sir, can you hear me, sir?
Yes, but the slide is not yet open, sir. Please
now it is coming. Now, have you got it, sir?
Yes, it is coming, sir. It is coming. Yes. Understanding.
Yes. So now it became very easy now because it is something attached with the reason, the cause of the disease is immunological. So wherever the immunological cause is present, where the environmental cause is present, where the genetic cause is present, there the homeopathy will be successful. So there, most of the homeopathic doctors are successful in controlling the autism cases and the children with autism, making them normally and feel them normally and making them. There will be 4 stages of autism cases, sir. There the homeopathy can cure first and second stages. In the sense, those patients, those children will feel normalcy and they can study in normal school. But the abnormal behavioral disorders, the 2 congenital by birth disorders can't be cured. So whenever we take the case of autism, we have to see the symptoms, particularly what is the real autism. The textbook autism symptoms, they can be cured by homeopathy. So let us start the understanding. Before this, I would like to tell that we have worked out on autism cases because it is one of the cause of autism is immunological in nature. So we have seen what is the immunology that will be disturbed in autism, what is the immunopathology, and how it will be reversed. We have seen in some of the cases, but because of already I am late, and the statistics preparation and slide preparation is the toughest task. So it took a lot of time. Now let us go to the subject, sir. Now the autism is a hidden disability. It is very difficult to understand the autism. And it is not easy to recognize when someone has this condition. Till the age of 3, the diagnosing pediatric problems is the toughest task. In the diagnosing the mental disorders will be the second toughest task. And for a pediatrician, it is very tough to diagnose or recognize someone is having autism. And whereas a homeopathic doctor has to diagnose means it will be more tough. So it is a super specialty cases. These all are super specialty cases that must be treated with homeopathy. You all have to maintain document this. Though homeopathy controls the autism, though homeopathy makes the autism patient near to the normalcy, bring them near to the normalcy, because of lack of documentation, has created a problem that to be criticized by allopathic doctors. So autistic people will have difficulty in accessing community activities. What is you will find, I will tell you one of the examples of a cinema that is in Tamil, it will be known as Sippikal Muthu, that is also in Malayalam, where Kamal Hassan is hero. So he is an autism patient. You can, if you think of Sippikal Muthu picture, you will understand the autism patient totally. So the autistic people will have difficulty in accessing community activities. They have difficulty in leisure facilities and other services. They don't know how to spend their leisure time. They will be always anxious and they don't know how to spend how to utilize their services. They will not have a goal. They don't know what they know. That is autism. These all mental symptoms you will find in homeopathic materia medica. And autism is also, there are many different nomenclatures for autism. Autism is known as, by other names, Autism Spectrum Disorder, ASD, Asperger's Syndrome, Autistic Spectrum Condition, ASC, Perversive Developmental Disorder. Perversive Developmental Disorder means usually autism patient will have more fear or no fear at all. See, they will introduce their finger in a small child eyes, or they want to catch the lizard or snake. They don't know whether to do or not to do. This is perversive developmental disorders. And they don't know how to use the sharp instruments. See, they will introduce their finger into the burning light. They don't know that it will burn. Or they will introduce their finger into the electrical plug. These all are perversive developmental disorders. The facts about autism. Autism is a lifelong condition that affects people from all backgrounds. It will be throughout life. Once the maturity comes, once we make the child to grow within normal company, then the child will go to the school, he will study, he will get the job, and he will be protected by his wife. During childhood, the child will be protected by their parents, later by his wife, later in old age by his children. But as the age progresses, the environmental changes, genetic changes, and treatment changes will have greater impact over the autism patient, and they will lead a normal life. Currently, more males than females are diagnosed with autism. Usually autism, it is more in males, less in females, because it is very tough to diagnose. We never understand the disability. And in Indian culture, a disabled, an innocent person is accepted and somebody will provide him some protection. And in school also, they will study in the normal classes. It is very difficult to find out. But the only thing is they will fail in higher classes. Up to 3rd, 4th, 5th standard, they will pull on. Later, it is very tough for them to memorize and they will be identified and they will live life as an innocent person. If family, friends, medication, everything gives support, they can lead the normal life. It is estimated that 1 in every 100 people will have autism spectrum disorder. See, for 100 people, you will find many homeopathic doctors also, many bank employees, many doctors who will be very calm. They will do only routine duties. Many people are unaware that they have ASD, they have autism, because they think that he is an introvert, he is an extrovert, he never talks, he never eats. No, it is autism that he cannot adjust with the society. I know many bank employees who have autism. They will be strict in the counter. There will be some person who is a friend. They think that they are introverts. They don't know how to talk. Their behavior is like that. No, it is only autism. A person who cannot enjoy the society, he will be known as an autism person. Autism people are different from following aspect. What is that aspect? Social communication and social interaction. See, a patient comes to a doctor chamber once, twice, thrice. Then the fifth time he will wish, good morning, doctor. He says, sir, how are you? He will ask. But this autism patient never communicates. Neither he smiles, nor he will have only strong sentiments. He will come and sit. He only likes, but he don't know how to express that he likes us. He don't know how to communicate to tell good morning. He don't know that he is coming to the clinic with his willingness. Like in one word, I can tell that an autism patient behavior will be like a veterinary patient. See, if you take a dog to a veterinary doctor, the second time it cultivates a habit of going to that particular clinic and it reacts and recognizes the doctor. In the same fashion, a autism patient also will recognize, reacts with the doctors, but he don't know whether to react, not to react. Social imagination and flexibility is tough. See, when he comes, there should be a seat vacant for him to sit. If he boards the bus, he has to find a seat. Otherwise, he cannot adjust. If he stands in the queue, he will stand without talking. If somebody is pressing him, if somebody is pricking him, he never reacts because everybody thinks that he is an introvert, he is an innocent person, so he won't talk. No, but it is only just because of lack of communication, because of genetic mutation, the autism patient will have such symptoms. Restricted, repetitive, interest of actives, only restricted, he goes and sits. He comes and sits. Whatever the order you give, he will bring it. Whatever he has to carry, he will carry. Otherwise, he says, you haven't instructed me. Restricted, repetitive patterns of the behavior. The behavior also will be like that. Unusual sensory responses. In the sense, if he stress more and more, he will keep quiet for some time. Then he shouts that you never ask me, don't. He will get angry. He will become, there is no angry symptom, but he develop anxiousness. He don't know how to react with that anxiousness. And unusual sensory response will come. He will leave the room and goes. Or else he will leave or he won't eat. He will disappear from the company. These all are autism symptoms where you will find in your normal life various patients because the ratio is 1:100. See, if you even go to vegetable market, even to the market for shopping, you can find with the shop owners, some of the fellows will talk very nicely. Some of them don't know how to talk. They will tell, will you take the goods? Do you have power to take? Do you have money? These all are autism symptoms. So autism people experience social and communication differences. The social communication is different from person to person. See, one is speech, second is language, third is gestures, four, eye contact. Usually most of the autism patients will not maintain the eye contact. Tone and voice, that person will bend his head and he will tell whether you have these goods. He will talk with slow voice. No, sir, I have, I don't have. He never responds. There won't be any gesture. There won't be any speech. There won't be any eye contact. Then the tone or voice will be very low. We have to interfere. We have to ask that we want this. Do we have this? Then only he will tell that yes, because he never maintains the eye contact. The social interaction, what is the impact in day-to-day life, what we will see, these all are social communications. For the social interaction, people often use body language or sarcasm. Sarcasm in the sense, we don't know that he is suffering from autism. Even his parents may not be knowing. But his language will have sarcasm. Sarcasm, yes, no, all right. That he says, no, how many times I have to tell? Are you not listening? No, because his language will be like that, because he don't know have communicability of the language. The second is, autism people may be perceived as rude because we do not know that he is an autism patient. So we will think that he is rude. And engaging in conversation, if he try to talk, that person never talks. Because he don't know how to talk. Because he don't have language skills. He don't have communication skills. Meantime, if he going on pressing, if he engage in conversation, then he will develop stress or fear or phobia or anxiety, and he will move away from us, or he will send some other person. If he, the same thing will happen in the society also. Whenever we go in people, or whenever we are in a railway compartment, we will feel such persons. They are shy to have conversation. We may think that it is shy. No, it is because of autism. The toughest person, the bold person, the person with common sense will tell that I am not in a mood, don't want to talk, or he will avoid us. But this patient will be afraid of us. He never engages in any communication because he cannot put the correct language. He will have sarcastic temperament. We think that he is having sarcastic temperament, but he suffers from anxiety. Showing concern for others. Suppose if an autism patient is there, somebody falls on the road, somebody is getting bleeding, somebody is having an injury, somebody fell down unconsciously. We usually will just see towards him, and we will see whether to be taken or to a hospital or not. But whereas a autism patient never cares him, he thinks that he has to go on the road, he has to reach his destination. Otherwise, his his owner or brother or father or his family may ask. So he never bothers whether the dead body is coming, who died in the accident, whether the accident is very serious, until and unless it threatens him. Usually they are afraid of these alcoholics. They are afraid of blood. They are afraid of strong colors. That only they remember. But they don't know that they have to show their gesture towards concern for others. If somebody sleeps, they never help. They don't know that they have to help. Though the idea comes, they don't know how to help. That is, their body never comes forward to help others. And understanding the humor. Suppose there is a joke. Somebody is asking, or somebody is mispronouncing, or somebody fell down. Usually a normal person, suppose if we are on the road, or if somebody slips on the road and falls without any major drawback or without any fracture, if he gets up, if we are on the road, we will see and smile. We cannot control. See, if the floor is very smooth, if some young fellow falls on the street or on the floor, everybody will smile. Then only they will lift. That humor, the falling is known as, see, everybody smiles, everybody reacts. But the autism patient will not have that sense of humor. He will not develop any sense of humor by reading the book or by joking or by anything. So they will be reserved. They will talk very less. They look as if they are very proud, but they are very anxious. The autism children, the social and interaction deficiencies, others are, autism children may find it difficult to join in the play. They cannot play volleyball, football, or any other street play because they cannot interact and they cannot join. See, if they are playing kabaddi or something, if they are playing volleyball, if they are playing football, they have to pass the ball to other person. They never pass. They don't know. They keep quiet. They stand there. If the ball comes, if it give them the instructions that you have to hold the ball, then only they will hold the ball. Otherwise, they don't know how to play the game. Difficulty in playing and joining with the children because they are tense. And the autism children may find it difficult to take turns and share. See, usually children, what happens? They will share their biscuits, chocolate, or their ice cream, and the candies. But the autism patient, the autism child, neither he takes anything from somebody, nor he touches others' food, nor he gives his food. If somebody takes, he will leave that food because he is afraid of him. He cannot argue with him because he don't have language skills. If he is hunger, he will show in gestures after a long time, or he will beat, or he will run away from that place. So the autism child will have a different character. Everybody thinks he is angry, he is ignorant. No, that is autism. So this can cause the problems in childhood, problems of friendship. Developing, maintaining friendship. Usually nowadays, there are no friends. Nobody is maintaining friendship. And every youth is busy with his computer. But at the same time, they will have one or two close friends. So not having friendship, not maintaining the gestures, not wishing a person, not communicating with any person, that means they are suffering from autism. The developing and maintaining friendship is not possible. Suppose we have various friends, we cannot make a friendship with various persons. So we will suffer in managing the friendship. Whereas an autism person will not have a friend at all. He never communicates. If we ask him, who is your close friend? He may tell somebody's name. If we ask him, have you telephoned him yesterday? Have you gone to him? Have you attended his marriage? He says, no, I haven't seen him from last 20 years. But he says, because we asked, he says, he tells his name, but he never maintains the relationship. It will be very difficult for them to maintain the relationship. They will be very silent. We will think that his behavior is introvert behavior. No, he is suffering from autism. May not engage with conversation. It is very difficult to bring them into conversation. Enjoy the discussing factual issues rather than small talk. See, we cannot ask him the history. We cannot ask him the geography. We cannot ask him the medicine knowledge. We cannot ask him the cause of the disease if he is a doctor. We cannot ask him about the game that if he plays. If he is playing chess or if he is reading the book, we cannot ask what is that book. We cannot make him to engage in conversation. These all are the symptoms to identify an autism person. We must be specific to bring the conversation to the end. If he start talking, he will repeatedly tells the same words about the same book, about the same incident, about the same train, about the same plane, about the same trip journey he has done. So we must, to bring his conversation, we must be specific. We have to give him commands. Now kindly stop talking with me. I am not in a position to talk. Then only he will stop talking. Otherwise, he is with us. He will be going on talking the same thing. He will tell the same story many times. So we have to give him specific instructions to stop conversation. Autism people may have difficulty in understanding the rules of social life. They don't know. See, they will come and sit beside us. They will split. Somebody goes to near the window and splits. But autism patient, whatever he wants to eat, he will throw the dust there. If he tell, he won't understand. If he tell, he will argue. If he tell, he will talk something. Otherwise, he will get up from the seat and he goes to other seat. But he don't know that he has to listen. He is only afraid of everybody. He is phobiatic personality. He is anxious personality, but not understanding the rules of the social relations. See, he will wear the dress. He never put all the buttons. If we ask him to go wear your shirt and go outside, he will wear the shirt. He never puts the button. We all will find these symptoms in our materia medica. Autism people may have difficulty and then many issues, including them offering truthful opinion. See, if you tell to an autism patient that I am going out and I will come by 2:30, if we are not in a position to return our place by 2 o'clock or 2:30, autism patient will tell to the caller that my boss told that he will come by 2:30. Then that fellow will ask, it is already 2:30. No, he asked me to tell this. Though we are physically present, he never says, sir, somebody is telephoning. You are here personally present. You kindly pick up the phone and speak. He says that, Sir asked me to tell that he will return back at 2:30. We will be physically present, but that fellow never says Sir is present. Because Sir asked him to tell that he has gone out. He has gone out, that is truth. He also came. When he is present, the dialogue that has been, the commands that have been handed over to him will be repeated again and again, and he will tell that nobody is present and he will come at 2:30. This will happen usually in inquiries. The bus will come and go, the plane will come and go, the train will come and go, but the reception will tell, the plane will come at 12:30 and it will leave at 3:30. If you ask the madam, it is already 4 o'clock, it left at 3:30, sir. That's all. These all are autism, high-handed symptoms. Predicting the reactions and events, you cannot predict him because he is ignorant. He don't know how to communicate. Problem solving, he don't know how to solve the problem. He will litigate with us. If he is in the counter, he will litigate with us. If he is our neighbor, he will litigate with us because he don't know how to solve the problem. Coping with changes, see, the flower pot should be at a particular place. It will take dust, he won't clean it up, but he never removes also. He cannot cope up with the changes. There is no planning for his life or for any spending or for money or for his clothes, or tomorrow there is an event, he has to wear good clothes. The autism fellow never plans that beautiful clothes or he should look handsome. He don't know. He never shaves. Creativity and imagination, he never creates anything. He never imagines anything. There won't be any daydreams for him. He never creates. Creativity will be absolutely nil. Whatever that comes to his hands, he will accept it. See, he never expects a good taste. If you give him food, he says, I cannot eat. Why you can't eat? He cannot express, he don't have a language to tell that the food is not tasty. He says, I cannot eat. So creativity, imagination. He cannot imagine. He don't know where is the good hotel. He don't know what the clothes, which color suits for him. He cannot create that he has to wear a good pant, good shirt, overcoat, slippers, shoes. Somebody has to give him, he will do it. That's all. Problem solving, they don't know how to solve the problem. See, when the problem solving is rarely social imagination, predict is possible, this is difficult for them. The imagination, the prediction, the problem solving. See, if a autism patient is there, if he asks him how to go to bus stand or post office, he says, I don't know the route. He is the native of that place, but he can't tell. If he asks him the give address, which is the street, he says, I don't know. Because he belongs to the same state, same street, same house, but he don't know to tell. Lack of communication. He cannot solve the problem. There won't be any planning. Difficulty without good social imagination. People often use calendars or plan. See, if we plan, we have to go, we will put the date, but a autism patient never uses calendar or diary or anything. They don't know how to plan. They don't know how much time it takes traveling from here to Delhi. And coping with changes, they never cope with the change. See, whatever that is, see, if the cot or bed in his room or a new table or anything that is fine, he never accepts the new thing. He will reject because he cannot cope up. He thinks himself, he imagines that he will be afraid of that. So he may never use. Usually prefer routines and unpredictability. Whatever routine that is there, whatever others are eating, they will eat. See, if you cannot ask a autism patient to eat a tasty food because he is afraid of taking any new product to him because it is looking in new color, so he never accepts. Autism people may find it difficult to predict how others may be feeling. See what that man came, whether if he ask him, was he angry? He says, I don't know. Has he liked you? He says, I don't know. Has he talked with you? He says, I don't know. Have we given any chocolates for you? He says, I gave, but I could not eat. I told him not to give, but he gave. Have you taken them? No, I haven't opened seal. So because they don't know how to react, they will the social imagination. See, if some postman comes and hand over cover, he says, "What is this? Where from it came?" He never asks. He will keep the cover. He will read the address with great difficulty. He will keep it there. And then we have to tell, "Have you received the cover?" "Yes." "Does it contain this?" "I haven't opened." Because prediction, reaction, and reaction to the events is not possible with autism patients. Creativity, imagination will be less. I already, they never create anything. They never, if you ask them to play the chess, they never play. See, if they play, they don't know how to move the coins. They don't have any planning. They cannot create. They don't want to win because they don't know how to win, because they cannot plan and imagine. And unusual sensory responses will be either more or less. These are the most important symptoms for a homeopathic doctor. Many autism people will have the perception of the sense either heightened or decreased. See, tactile touch sensation will be more at some place. Even if he touches, he never moves. Vestibular, the movements will be, he will move his both the legs. Or if he stop him, if he scold him, then only he will stop. Then taste, he says, this food is having excess salt, excess sweet, or no sweet at all. Body position, that is proprioceptive. See, he will sit, if he sits in the chair, he will stick tightly, strictly. He never moves. It is not that he is giving respect to the elders. He don't know how to sit in the chair. And visual, olfactory, auditory. Either the auditory, the hearing will be less, or hearing will be oversensitive. Olfactory, they will sense. If you take a autism patient to somewhere, he says awkward smell is coming, we will tolerate. Suppose we are passing by a road, there will be urinals. We know that there is urinal smell is coming. We will close our nose or we will cross that because we have to go to bank and we know that there is no other alternate. But the autism patient, he will stand there. Why are you not coming behind me? He says, too much of bad smell, I can't come. If you ask him to close the nose, no, he says, I won't close the nose. See, these are our unusual sensory responses present in autism patient. Visual response, if the color is shining, he won't travel further. If the metal is shining, he says some light is coming from there. But he never expresses, he will stop. So we have to manage him. You will find such friends, you will find in your family, you will find some relative. That's why I told you one example is that Sippi Kalmuthu, Kamal Hassan picture. He is an autism patient. Sensory are joy from certain colors. They will enjoy some color, some blue color or some color, some color. They will enjoy the color, then the product. See, if you ask him to, if you provide him cool drinks, he likes the color of the cool drinks, not the taste of the cool drinks. Dislikes certain colors. Decreased feeling. See, if he have thorn, if he prick, he will feel pain. Sometimes the autism patient never feels any pain. See, he will tolerate the heat. He will tolerate the pain. Sometimes he will be very sensitive to touch. Tolerance to touch, certain smell. They like cold. They will bathe in cold water. At the same time, see, if we ask them to bathe in cold water, he never takes the cold water. But once he comes from bathroom, he will switch on AC. So we cannot predict that person. Distress, anxiety in busy environments. They cannot cross the roads. They are afraid of crossing roads. Difficulty around the noisy traffic. They are confused. See, somebody has to make this. We will feel that they are innocent. A young fellow, around 17, 18, 20 years of age, he will find it very difficult to cross the roads because he is an autism patient. Whereas nearby him, a dog will run away like that. So we can easily understand. Then speak slowly and see how to communicate with them. We have to speak with them slowly. We have to see that they will develop confidence in us and speak clearly. Allow time for the person to process formation. When we talk, we have to take that paper, take that pen. The pen is in the pen stand. The paper is nearby it. That is white color in nature. Don't worry. Sit there. Take the pen into your hands. We have to, because if he speaks slowly, there will be a formation of the process in his mind so that he can take the paper. Then we can ask him to sign over the paper. Then only he will sign. Because the process formation needs time. But if he speak with fastness, if he think that he is having common sense, he won't understand. Keep instructions short. We have to keep, if we instruct him, you have to come by 1:30. No, we have to tell them, you have to come definitely by 1:30. You have to come with this route. And he will come only with that route. You should not drive more than 30 kilometers. He won't drive. But if we give him instructions that you walk slowly, then if he give the second instruction, you walk fast because we have to reach in time. He says, you asked me to walk slowly, then now asking me to walk fast. He will listen only to one instruction. He cannot manage the two instructions because his common sense never works. We cannot use with him the language or idioms or proverbs. If he use the proverb, he will tell that he used, suppose if he tell early to rise, early to bed, he will remember early. He never remembers anything. He says, father asked me only early. He asked me to get up early. He don't know early to rise, early to bed, early to rise. He cannot use the idiom. See, you have to do yesterday's work today, today's work tomorrow. He says that person used only today, yesterday. He cannot understand the proverbs. Avoid relying on gestures, facial expression, tone or voice. See, we cannot predict him because he cannot communicate. He will use either his facial expression or gestures, or he will speak loudly and he says that I won't oblige you. He never says he won't oblige, but he never accepts us. And up to you, we have to learn communication in dealing with autism patients. If autism patient is in our family, adopting treatment. Autism is what is autism? Now, little there I will end within 2 minutes. Autism is a complex, lifelong biological disorder, development that results in social interaction, problems, communication difficulties, restrictive, repetitive interest and behaviors. Biological disorder of development that results in social interaction. They will be unsocial. See, they will wear the banyan in reverse side. If you ask him to wear the banyan in normal, he says, no, the reverse is normal. If he is having communication skill and adaptability with us, otherwise he never listens. See, they don't know the unsociability. Then causes of autism. In majority of the cases, unspecific underlying cause, variety of the factors being investigated. Now the latest factor is immunological, metabolic and genetic. Now the genetic is the chromosome has been identified, the susceptibility, the need involves multiple genes, and these all can be corrected. And because I want to restrict the time, now there is a second part here also. Now I cannot because we have seen 3 autism cases which we have given, because autism is immunological in nature. What are the immunological modifications that are coming? What are the cytokines, immunomodulation that is taking place in autism, in the disease, and what is the response after giving the homeopathic treatment has been seen. And in that, the most effective, you will find from conium maculatum to magnesium, mure, arum metallicum, everything. But the most effective medicines are Calcarea groups of drugs. So thank you very much. Now we will have a discussion, please, because always I am speaking much time. I am not giving any time and opportunity for people to discuss. Sir.
Yes, sir. It's really a very good presentation as far as this World Autism Day, and this is what a presentation for this day. And as you rightly point out, that there will be another session, so we can arrange that also, so that you
yes,
can.
Yes, sir. Because the treatment and effectiveness of the treatment must be understood scientifically, sir.
know
because
that,
the homeopathic doctors will get autism cases more, and they will also control the cases to the entire satisfaction. And many autism people who are treated with homeopathy are
yes, sir. Yes, sir.
managing normal life. So that has to
Yes, sir.
be documented.
We will have a second edition of the same, and we will directly go to the discussion session, because already
Yes,
at the
sir.
beginning,
Yes,
since we lost some time, but we utilized
Yes,
that
sir.
time. Dr. Sridhar Kurusar sir has presented one of his case here, because he had a twin case of autism, where twins were affected. One has having autism alone, and that case was totally cured with his treatment. And anything, I think that he want to add something more about that. And yes, Dr. Sridhar Kurusar, you can speak now. And those who want to speak, and raise your hand so that we can allow you to speak. And please get ready for that. Yes, Kurusar, you can
Sir,
speak.
Kurup sir, kindly give your experiences, sir, please.
Yes, that let me. Whether it is audible?
Yes, sir. Yes, sir.
Yes, sir.
Yes, it was not. See, this is a book. Everyone like better to, you will know your child, B.B. Joseph. It is a very good book. That there it is everything, colitic diseases, it is mentioned about it to 30 chapters it is mentioned. It is very good book. That I went through that course. So I treated in different ways, but I feel there are some medicines, Ethusa, Baraitacar, Coffea cruda, Iosiamus, Kali, Bromium, Lysine, Rheum, and Tarantula hispania, and Tarantula cubensis also. These are the very good remedies that also will help that very much. But I feel that along with that our treatment, even that there are that the psychologist, and also that the along with the psychiatrist, and also with the assessment people are there, which they are called that the occupation therapist also there. If you may give along with that, the cure will be very easy and rapid. What is my experience? That I saw, I am in an association where that this know your child, that I am in association, about more than 300 mothers are there. All children are from America to Australia. It is there. I am every Tuesday. We are uniting together. I am one among them, always discussing with them and getting very good. Even it is not curable, that some of the cases are far better. They will be independently, they are able to live. Otherwise, they will be handicapped if we may not care them. So it is our duty to care them. And there is and it is telling one doctor, according Dr. Cindy J. Jaffrin is telling that Texas, USA is telling that the vaccination is the one of the main cause of all this autism, what he is, according to his research, he is telling. This because some others also maybe like to talk. So I am not going to very deep, because I can talk like that. Anyway, your presentation was very excellent. Keep it up. Always you are one of the best presenter in our sessions in our the IFPH. Thank you very much. Whenever we may call you, you are ready to do it. Thank you very much for your this enthusiasm and your effective conducting this session. Thank you very much.
Yes,
Because
Kurup
there is
sir.
also maybe waiting for that. Is why I'm
Yes, sir. I think it was last year. It was you, who has presented autism this stage during this autism day. Last year, Dr. Sridhar was the presenter on the autism. Sir, target or not, I don't remember.
There are every week 3 or 4 example. Yesterday there was some this every day I am taking some classes.
Yes, sir. Thank you.
Psychology or counseling like that or subject. Now just immediately
Yes,
after that I am going to enter for a counseling class.
Yes,
So,
yes, sir. Yes, thank you, sir. Thank you once again. And PRAKASH sir, please close the screen sharing so that we can have.
Okay, sir.
And as Sridhar was telling, sir was telling, this autism, one of the main reason everybody used to say is that the vaccination is one of the reason for that, because in the US, the 11th child is an autistic one. This is the latest research report from US, but they don't. And they never say that it is because of this vaccination, because they want to promote vaccination, and selling the vaccine is better than treating a patient. That is what is their motto, and they are that is the reason why they are doing research in their favor. But we are unable to project these things rightly to the public. And I think Dr. Manoj is there. Dr. Manoj can speak for a while, because time is very less. And then if anybody wants to talk, please raise your hand so that we can allow you to speak.
Yes, definitely. These are the causes and everybody knows, but everybody keeps silence because they want to protect their interests. That is the most important thing. So many reasons are there, business reasons. Even though it's a clocked car of their, as said by Dr. Kent, car of their scientific rascality, they were used all these technical terms. Then questioning about the scientific studies. In fact, all these scientific studies went against the experience, but nobody did questions. That is a fact. So unfortunately, we have enough medicines to counteract the effects of this vaccine. That is most important. That is the most, I think, that should be the area of interest to the common man. So should give more propaganda to that. Otherwise, there is no other scope and hope, I think, because the world is controlled by the so-called economic and corporate interests. That's the most important thing.
Yes, this is what that's a very fine observation, Dr. Manoj. I think it is a time to wind up the session. I invite Dr. Subhajit Banerjee to say a word of thanks to this session. Dr. Subhajit Banerjee, please unmute yourself and you can say a word of thanks. Yes, Dr. Manoj can say a word of thanks.
Yes.
There is no doubt about his quality, his potential. We are very aware of that. On behalf of IFPH, I'm expressing sincere thanks to Dr. PRAKASH Rao sir and all those who participated in the program. Thank you.
Yes, there is a big announcement for tomorrow also. Tomorrow we will have a session from Dr. Ismail Said. You can have a 1 hour presentation from Dr. Ismail Said. You can ask anything to him about homeopathy or anything else, because he is the chairperson of our forum and he wants to have a session with you. And that's the day, that will be a great day for you to celebrate with IFPH. This is what we say, that we have started our countdown of 1,000-day celebration. Today we have Dr. PRAKASH Rao and tomorrow Dr. Ismail Said sir himself. And with that, we wind up the session, and now it is up to Dr. Ashok Kumar to take over for the Malayalam session. Thank you all.
Namaskaram, sir. Thank you.